So my screen is visible to all of you. This book, huh?
Yes, sir.
Yes, sir.
Yeah, okay. Now, see, we have already discussed all of these areas. Now, let us start with the next point. That is, what are the various steps in doing any public health research? Okay. So the clarity has to be there, so that, because you also have to make up a thesis for your master's program. So you have to understand the points very efficiently. And if any of you want to go further to do your PhD, or you want to go into international organizations like Doctors Without Borders, or say WHO, or you will say this one, USAID, so you, or World Bank. So for this, you should be very clear about how to conduct a public health research, and what are the various steps in understanding the same. Okay. So this thing has been written in. So I would really tell you, all of you, to make your notes as well at the same time when I'm speaking. So maybe there are certain points which are not there in the book. So you can always have a clarity of the concepts, and you can I will give you more papers, or more reference text in order to understand it further. Okay. So as you can see over here, before we start any public health research project, the research partners, that is the researchers and the community members, have a clear understanding of the broader goals of the research project. Now, the important aspect is, like, for instance, I would say, like, what are the skill sets that are required for a public health researcher? Yes. Because see, you can do a research, good, but then what type of a skill sets that you should have to be a competent public health researcher? Because only when you are competent, then only you can do a good research, right? Do you all agree or disagree with me? Yes.
First of all, we have to be very much sure that why we are going for research. What is the purpose behind it? Why
Okay.
I'm going for this research?
But before even going for why I'm going for research, I just asked what should be different type of skill sets that a researcher should have. For example, you have got an experience of 40-45 years of work, right?
Yeah, the answers.
But just a minute, let me. But do you think, like, even having this experience, it qualifies you to become a good public health researcher?
No. There are some criteria. There must be some skills which must be acquired.
Okay.
For people to say or to be recognized that you are a researcher.
Okay.
So for this, you must be.
Yes.
So strategy according to subject.
Strategy according to the subject. Okay. Can you elaborate with some example? Yes. Can you elaborate with some example? Like, my first question is, what a public health researcher should have? For example, let me, for example, suppose one of you is from the field of medicine. Okay. So you are from the field of, suppose I will say, one person is from the field of medicine. The other person is from the field of psychology. The third person is from the field of pharmacology. The fourth person is from the field of homeopathy. Now, what is the common ground? How you can all integrate and become a public health? Well, how do public health researcher unites all of these?
Common health problems of people.
Okay, so I will take it. One is the common health problems of the people. Okay, then Yes, Babicha. Yes, Dr. Hussain, what you want to say something?
Yeah. I was speaking. I was
Yes,
just trying to.
your mic
Yeah.
got muted, huh?
No, it is open now.
Yes,
Yeah. So a person should be a good analyst. Analyst.
analyst.
Yes.
Okay,
So
okay,
he must be very much confident and have a practical skills in analyzing the data. He must
okay,
be a good. He must be a good reader of. I mean reviews. I mean the
okay,
papers which are being published from time to time.
okay,
Is related to public health. I will say that related to public health, and of course the public health is a broad discipline. In that discipline, many things comes up. So he must
okay,
be a good reviewer. Hmm. This now you must have a basic knowledge in his domain and the works which are being carried out or different types of research going on. He must be a person who should be keep himself updated from time to time. What are the newer technologies which have come up? I mean from the electronic point of view, I can say
okay,
that which helps in compiling and analyzing the data. like uh,
okay,
like in uh, like in I can put an example in that in Excel sheet. If you want to do the chi-square test or whatever it may be, Z or T test, how can we do that this thing with the help of electronic uh, this thing? Uh,
okay,
so
okay.
this
So what you are telling is a broad perspective, huh? What you are saying is that one should have a broad perspective of the things,
hmm.
right? Am I understanding it right? Okay. So, Babicha, what is your thought about it? How to go about, what are the skill sets that are public health? So one thing is public health researcher, according to you, should have a broad perspective. Okay. What else? What else? Just if I tell it in a different manner, if I use that term now, because this war is going on between, let's take up a very practical example. If I'm saying like this war is taking place now between Russia and Ukraine, does it affect our health?
Yeah, definitely.
How? How?
Because we are seeing that lots of health centers are coming down due to due to escalations of war, and people are not getting access to medications, and they are under mental trauma. They are
No,
foods
I
like
am talking about we as Indians. Suppose if I'm living here in KSA and you are in India right now. So are Indians getting affected by the war? Is this whether it should be a
yeah,
concern in public health research?
yeah. Why not? Because you see, many people, many Indians, Indians, they have their children outside over there. So
Okay, so
they are
they
under.
are the direct stakeholders since they are living over there and they are getting affected. And what about us? And what about us?
And we are in the agony. Those families who are having children over there,
But
they
but
are.
but only those children. Suppose the war is taking place between Ukraine and Russia,
Mhm.
there in the Central Asia, and we are sitting over here in the South Asia. So are we impacted by this war? Leave apart, of course, those the family who have sent their children to Russia for the study. Okay, that is definitely because these children are under stress. They have about 5.5 years of study duration. They have to study, no doubt about it. But what about as we can it be does it has implications on health?
Yeah, because of their agony, they are suffering. We are having effects, or we are having a mental. We are under mental trauma.
Okay, 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 fine. Yes, anybody else? Rajiv, Shamta, Ujwal, do you think are we affected by this war?
Yes, sir.
If yes, how? If not, why or how?
सर another things भी है because of them क्योंकि हम लोगों का जो जरूरतमंद एवरी डे जो लगते हैं हमको हम लोगों का वो सब हम लोगों को तो यहाँ पे नहीं मिलता है
जैसे
कुछ कुछ जैसे सर क्रूड ऑयल
अच्छा
पेट्रोल
तो पेट्रोल
सर
क्रूड ऑयल तो
एक्चुअली
इंडिया में
इनको
आता है ना, वो सप्लाई आती है, वो तो देती है गवर्नमेंट, मतलब गवर्नमेंट जिस रेट पे भी देता है। अभी तो इलेक्शन की वजह से जैसे अभी आपका प्राइस कम है, कल परसों में आपको पता चल जाएगा वो प्राइस 130 रुपीज तक जाता है या 125 तक जाता है, क्या होता है।
So most
yes
of
sir
the oil exports come from there only, sir. So the oil
Okay.
rates have been increased.
Okay, so if the
Uh,
oil rates are being increased, then how does it affect health of the population of India?
People might be using the other oils which are not of good quality, so it may affect in that wise.
I could not, but oil we don't eat, means it is only oil we require it for vehicles, or we
Not oil,
require oil for
no,
other. Which
sir.
oil you are
It's
saying?
not a vehicle oil,
Edible oil.
sir. It's edible oil. The
Edible
export
oil.
of edible oil, yes.
So, but do the export of edible oil will get affected by a war between Russia and Ukraine
Yes, sir. It has been already.
already? How?
Sunflower oil is exported mostly from Ukraine only, sir. So because of this war, the oil rates have been increased.
Okay, okay, but but in India more than 80 crore people are below poverty line. Can they actually afford oil? Mean
No,
maybe
what the point lies that due to this war, we will be taxed. Our pocket will be taxed. Why? Because due to the escalation in the price of the oil, definitely the rate of oil will go up, and if the rate of oil goes up, then the commodities, the I mean the cost of the commodities, that will definitely go up. So we'll be taxed.
okay. Okay, so this is one aspect. Okay, what else? Because see, when we talk about public health research is not a minuscule. It's having a lot of other components. Okay, so what I mean to say is, and why I'm discussing, so clarify the purpose of research. So clarity has to be there. Okay, now suppose even on a thing in a very basic thing which I am discussing right now. So I just want to bring you all to the point, like that unless and until you brainstorm, unless and until you discuss the topic from the top, bottom, right, left, diagonally, okay, 360-degree, you won't get a clear-cut idea about what you actually want to have. Okay, so without having a proper understanding, you should not go ahead with the research. It is as simple as that. And then once you discuss it deeply, then you make it very specific. Like this is one component I want to study, because when you talk about research, there is a lot of area we diversify a lot, and we basically off track from the aim. That is a very common problem that happens in research. Okay, so the broad objective are different, and the specific objectives are very different for any research. What exactly we want to know? So when I'm talking in terms of research, the first thing and the foremost thing is clarifying the purpose of research. So for example, like I asked you, how the war is going to impact us, So this is one aspect. You said maybe the commodity prices are going to increase. Okay. And because of this, we will be taxed. So this is one part of the scenario. So I want to understand, if we are taxed more, how will our research will get affected? Still, I have not got the full answer for this question. So only one part. Okay. So those people who basically, who will be buying the things, maybe the cost will go high and it will affect us. But how does it affect the health of the people? So we need to have a more clarity on this. So this is one dimension. What else? What else? How the health of the people will get affected?
If the purchasing power of the community comes down, is affected.
Okay.
Then definitely people will not, the nutrition will be hampered. The
Okay.
nutritional status will be.
So this is a direct impact. If the prices of the commodity, suppose milk, okay, it will go high, and the person used to buy maybe half a liter of milk. Now it is suppose costing 60, 65, 70 rupees. And tomorrow if the prices go up to 90, so definitely the person won't be able to access, it means availability won't be there. Okay. Okay, what else? What else? This is one dimension. So I understood what you are trying to say. This is one dimension of the picture. What else? Think more. Think more objectively.
सर
हाँ,
एक फैमिली का बजट होता है,
अच्छा है, फैमिली का
वो
बजट होता है. ओके. ओके.
डिफरेंस पार्ट में वो सेपरेट करके रखते हैं. जब एक चीज बहुत ज्यादा महंगा हो जाएगा तो तब ये बजट अदर चीज से वो थोड़ा कम हो जाएगा.
ओके, ठीक है.
मतलब सर एक्सपेंडिचर थोड़ा.
ओके, गॉट योर पॉइंट. ठीक है, ठीक है. ओके.
वो हेल्थ
Ujjwal, your voice is not clear. It is breaking. ये क्षमता सिंह.
सर जो वहां से यूक्रेन से जो आता होगा वो अगर हमें वो मेडिसिन या सामान ना मिले तो यहाँ कमी होगी, जिसकी वजह से फिर महंगाई तो बढ़ेगी बढ़ेगी.
अच्छा, ठीक है. तो अल्टीमेटली आप ये कह रहे हैं कि अगर, तो ये घूम फिर के मतलब एक एस्पेक्ट है. तो आप सभी ये बोलना चाह रहे हैं कि देखिए, अगर कहीं पे भी कोई जंग होती है तो जंग होने के वजह से मतलब एक तो ऑयल के प्राइसेस पे इम्पैक्ट पड़ेगा, है ना. अच्छा, ऑयल के प्राइसेस पे इम्पैक्ट पड़ेगा, जिसके वजह से चीजें महंगी हो जाएंगी, और महंगे होने की वजह से पर्सन वोंट बी एबल टू बाय दैट थिंग. सो दिस इज वन पार्ट ऑफ द स्टोरी. ओके. Now, if I want to look in any public health problem, I would try to look it through the lens of different population groups. Okay. So suppose if I have to see this problem, I would try to see, okay, how does this war affect India as a whole? So whether it is going to affect in terms of economics, socially, what will be the impact? So I will now try to refine it more clearly. So first of all, I would try to say, what is the effect of this war on India's public health directly? So there will be direct effect. Second will be, there will be indirect effect. The direct effect would be, say, if there are certain things, like for instance, if because Ukraine has been doing, suppose $1 billion business in India, and similarly Russia has been doing, so maybe because of the sanctions, do you think this NATO and the US has put up certain sanctions on Russia?
Yeah.
Okay. So when the sanctions have been kept, so as a result of which, whatever, suppose just so you need to see what all we used to import from Russia, what all we used to import from Ukraine. Okay. And as a result of which, since now there is almost a ban on the Russian government, that you cannot do a financial transaction. And suppose since it is the closest neighbor, so now you have to look for alternative sources from where you have to get the same thing at the same price, which is not at all a easy task. So it affects the health of the country directly, and it will help affect the health of the lot of other countries as well, because now post 1992 the world is a globalized economy. Whatever we do, we have an impact on everything, say whatever it is. Second important factor is, like, because of this the oil prices will go high. Why the oil prices will go high? Because previously the oil was basically sold at $75 barrel. Now Russia is one of the important, US was also supplying. It is a Russia is a very important part of the OPEC. It is a part of the OPEC member. What is an OPEC? What is an OPEC group? Yes, what is an OPEC group? ओपेक का नाम सुना है आप लोगों ने? यस, ओपेक क्या करता है? ओपेक एक ऑर्गेनाइजेशन है जिसका है ऑर्गेनाइजेशन ऑफ पेट्रोलियम एक्सपोर्टिंग कंट्रीज। ठीक है ना, ये दुनिया में जितने भी ऑयल प्राइसेस हैं ये सारी ये कंट्रीज मिलके, जिसका रशिया इज वन ऑफ द इम्पोर्टेंट मेंबर्स था। तो रशिया और आपका ये सऊदी, ये सब मिलके एक पूरा का पूरा इन्होंने अपना एक कार्टेल बनाया हुआ है और ये रेगुलेट करते हैं सारी प्राइसेस। तो at the end of the day, if it is going to be affected, then the oil prices, so immediately now the oil prices have reached up to 126 डॉलर बैरल। और आपको पता है ये सारी ये पेट्रो डॉलर के अंदर काउंट होता है। व्हेन द पेट्रो डॉलर इज गोइंग टू इंक्रीज, सो ऑल द प्राइसेस ऑफ द थिंग्स इज गोइंग टू इंक्रीज। सो व्हेन द प्राइसेस ऑफ द ऑयल इज गोइंग टू इंक्रीज, बिकॉज rupee is depreciating, because the rupee is depreciating, the commodity will become expensive. Because why the commodity is going to be expensive? Because of the petrol prices, the transportation will be costly. When the transportation would be costly, naturally it has to be surpassed to the population, and it is curtailed. Third thing, how it directly affects is, see, every country has got a budget, and every country has got a basically a corpus to manage all these things. Now what has happened in India, its budget this year, if you look into the health budget in March, it is still calculated at the rate of $75 barrel, and it was criticized heavily by all the think tanks that the entire budget of the country is going to be affected. Now because of this war, it is going to cripple down a lot, and the government spending on health, what used to be 0.8% of the GDP, would be even lesser than that, which is directly going to affect the Anganwadi workers and the other all areas, the national health programs. So all the stakeholders who were direct beneficiaries of all these things, and if the government did not had enough money to manage all these situations, so it is directly affecting the health of a population. Leave apart the other aspects, when the people are paying from the pocket, directly from the pocket, because in India 70% of the people pay out of pocket payment, like we directly give in cash, whereas rest of the 30%, it is either the government beneficiaries or the other aspects, maybe the insurance and all. So it is directly going to affect not only the out of the pocket payment, but also it is going to affect the people who are the directly beneficiaries of the government policies. Apart from this, there are other, because now there's a tussle. So maybe even the foreign funding to the NGOs in India might also be curtailed. Now those NGOs which are being working directly on a foreign funding, because previously last year you must have heard like lot of organizations in India lost their FCRA. Now suppose if there is a political clash, then these programs are going to be hampered even more. So these are some of the financial aspects that affects the health, because finance is directly related with any of the national health programs. So if the finances get affected, so automatically the outcome is going to be affected. Apart from this, there are both the indirect effects more. So one is this economic aspect, which I've told you. The other would be social aspects. Social aspects may be in terms of environmental issues, maybe in terms of the other aspects. For example, like now the children, like the 20,000 students, what you told, who are going there. So by when they can complete their degree? Okay, so suppose, and what about the investment? So will it affect the mental health of such people, particularly of those people? Or will India will lose its stand as a part of the United Nations when it is not taking a direct, against? So there are a lot of political situations that can affect the health in a broad manner. So when you do any research, there are social impacts, there are technological impact, there are human impact, there are social impact. So you need to understand what broad area or what minute area you will be focusing your research on. Will it be only on health? Will it be addressing the socio-economic issues? Because social issues are different, economic issues are different. Will it be impacting the technological aspects of health? Now suppose if some of the medicines that we were procuring, and the raw material used to come from, then it is directly going to affect that industry as well. So you have to see in totality, and you need to understand that what are the goals of the researcher and how the goals of the researcher are basically correlated to the community at large. Because in public health, how we define public health, like I've told you, it is basically talking about the population about the population at large. Now if your population, what it is, what will be its impact upon the whole population, whether it is going to affect only particular population, or the aging population, or the young population, or the middle-aged population. So what all population you are talking about? So suppose in this thing, if my topic would be, I would say how this war might be affecting the direct beneficiaries of the public health programs in Indian scenario. Is it clear to everyone?
Yes, sir. Yes, sir.
Yes,
sir.
sir.
Okay. So this is one of the important aspect. So without a sense of, because like technology, now you have a mobile technology, you have got e-technology, m-technology, then there are certain programs. So you need to understand this effect, the effect of such programs, based on the health scenarios, based on the technology. For instance, like how do the mobile technology is going to enhance the delivery system in among Anganwadi workers? So if you have got a software where she can go to the houses, she can record the data, she can bring that data can be accessed. By using that data, can you actually improvise the institutional delivery in people? So that will be basically the impact of technology on improving the health services of a particular community. Okay. So what is important over here is, you have to develop a very practical and effective PR project. You need to develop a mission statement. Now the question is, what is a vision and what is a mission? What is a vision and what is a mission? Yes. What is the vision of a project and what is the mission of a project? So in any public health research program, we make a 4x4 table, where on the left hand side we divide into vision, mission, okay, vision, mission, input and output. And on the top, on the right hand side, we put up OVI, MOV and threats. That's a 4x4 table. So this is the general, tool that we use in order to develop any public health project. So my question is, what do you mean by a vision of a project?
Vision means that my aim, the broad aim,
Broad,
which
okay.
that is the vision. It may be achieved, it may not be achieved.
Okay. And what
And
about mission?
mission means that there will be some targets that you
There
have to
should be,
achieve. So
there
specific,
should be some
some
targets that you
specific.
want to achieve. Okay. Okay. Yes. Anybody else?
Sir, vision is a long run objective,
Okay.
and mission is just like a roadmap of how to achieve the goals which
Okay.
we set in the vision.
Okay. So for example, if my project has to go for a full 1 year, okay, and if my goal is to reduce the infant mortality rate of a particular area. Okay. So say I want to reduce from 56, I want to bring it to 36. So what is my vision and what is my mission?
Vision will be to bring down the mortality rate.
Infant mortality rate.
IMR.
So
And
IMR can be brought to 36 within 1 year?
no, my aim, my goal will be to reduce the reduction in infant mortality.
Okay.
And my mission will be that how much, what will be my target, from where to where I want to bring down the IMR in
Okay.
terms of numerical.
Okay.
I mean rate.
And how this vision and mission changes according to an organization? Suppose you have a public health organization, you are a public health organization. Okay. So I'm taking two examples. One, in terms of when I have a specific research problem, a health problem, and I want to develop the vision and mission for my public health project. So this is one part. The second part, vision and mission in terms of any public health organization. So what will be the vision of a public health organization and what are the mission of public health organization? Because without vision and mission, you cannot, suppose I have to buy a ticket, I have to go to Calcutta, so I will buy a ticket for Calcutta. I won't buy a ticket for Bombay, right? So it has to be very specific. So it is written over here, we develop a mission statement. So we have to develop a mission statement. For mission, of course, vision has to be there, then only the mission would be there. Yes. So one thing that you said is, you are saying that vision is a long-term objective. Okay. For example, a 5 years program, 5 years planning, 5-year planning program, which the government of India used to, now it is being called, given a different name, but it is ultimately the 5 years planning program. So within 5 years, we are going to achieve this, from this to this. So this is a 5-year program. And every year we are going to review whether we are going to increase our budget, we are going to decrease our budget, we have to increase more man force. So I'm working on the next level so that within 5 years I achieve this. My vision is to, make by using pulse polio, I want to make a polio-free country. So they made a project, and within 10 years, 15 years down the line, they said, okay, we are going to achieve this target by this year. So that was a vision, and then there was mission on every year. So this is one part. Okay, mission means we are going to decrease it, and we have to shortcut it by a specific agenda year on year. Like from 56, we cannot come directly to 36. From 56 might be, we will be trying to achieve for 54, then to 52, then to 50, and then automatically over a period of time to 36, right?
Yes, sir.
So year on year, I will keep on changing. I will see whether my things are working or not. And for this, I have to develop by output and the input. Output it, what I'm going to achieve month on month. For example, if you want to come first in the class, So you have to be a proper strategy in order to come first. It's not like one day you will take the book and you will study and you'll go to the exam and you will write. But then there has to be proper assessment, and based on this, how you have performed in midterm, then yearly, and then so and so forth in 2 years down the line, so that you can become a gold medalist. So like there is a specific. But how come how the same concept changes in terms of organization? Yes. So if I want to make up a evidence-based practice, good research organization for public health, so what is the vision in this and what is the mission in this? For example, say research partners could develop a mission statement that identifies desired outcomes and the general strategy for getting there. It is written over there. So what is vision and what is mission in a healthcare organization?
Taking the example of the polio eradication program in India, this is a very very good program, and we have that eradication of polio.
Okay.
So that eradication polio could not be done in a day or two. So I've been striving for this for quite a lot number of years.
Yes.
And our always the broad aim was, as you say, that that eradication of poliomyelitis from India. But the mission will be, or the target will be for the WHO or the UNICEF or any other organizations. They are all stakeholders in bringing.
You're not audible.
The target will be the vaccine coverage.
Okay.
The vaccine coverage of the children. So then the next thing will be that the screening of the surveillance. The screening of.
But here, Dr. Hussain, see, India is such a big country because every state is like a country, right? We have got 33 states. Every state, the population and the dynamics of every state is different. The health status of every state is very different. So maybe what Kerala is going to achieve, maybe in Uttar Pradesh, it looks a very distant target. So you need to have different mission for different states with their own benchmarking, isn't it? So there cannot be a common benchmark for every state.
Yeah, definitely, because resources and other things that differ from state to state.
State to state, the budget also changes. Then the population, the public health problems over there. I mean to say the availability of healthcare facilities, the accessibility of healthcare facilities, and the affordability of healthcare facilities. But what I'm asking from all of you is, what is the meaning of mission in a healthcare organization? So vision is, in a health. Yes, you want to say something?
Sir, actually, according to Dr. Hussain, मैं बोलना चाहता हूँ सर, एक्चुअली विजन कुछ जैसे प्रोटेक्शन, प्रमोशन, प्रिवेंशन, ऐसे कुछ, और मिशन मेनली इरेडिकेशन द टोटल प्रॉब्लम.
नहीं, but वो तो आपके strategies हो गए ना. What you are saying are basically the strategies. There could be different strategies working at a community level. Okay, so that is an altogether different part. See, from an organization perspective, one is from a project aspect. We said we want to eradicate it, and for eradication, it might take 20 years, 25 years. Okay, and we want, for example, now India wants to become a 5 trillion economy. So they said, the government said, we want to become a 5 trillion economy by 2025. But how come India can become a 5 trillion economy when 11 crore people have lost their jobs? Can it become a 5 trillion economy? No, it cannot. Because for making it a 5 trillion economy, year on year, your growth should be around 8 to 10% every year on a positive. Same like what happened in 2008-9. So when you are unable to achieve that sort of, and on what it is dependent, it is dependent upon the manufacturing sector, the service sector, the agriculture sector. So all has to work in proportion so that the GDP India is going to achieve is almost like 8 to 9% growth. Then only it is possible. Same like what China has been growing at 6%, 5%, 6%, and still it is making a lot of mark. So that is one part. But what I'm asking is, in terms of an organization, the vision basically means what you want to be. Okay. For example, suppose I want to become a John Hopkins. Okay. Suppose if I am saying I want to make the best research institute in India. So that is my vision. My vision might take 20 years, may take 30 years, but I want to become like that. I want to be the next John Hopkins. For example, in India, the government will say, how many institute of eminence we have in India right now into the world ranking. So even the IITs does not come, maybe 2 organizations from India come into world 500. Only 2 institutes. Such a big country which has got more than 500 universities. China has got 5,000 universities. Only 2 institutes in India are come only in world ranking within 500, only 2 institutes. So it's a shame for us, for a country for 140 odd people, crore odd people. So that means our vision is not there, and even the mission is not there. Now the mission means for any organization, the purpose for you to be there, why you are there. So the organization asks itself, for instance, suppose if I'm working in the area of public health, I'm working in the area of maternal mortality rate or the maternal health. So the organization is going to ask itself, it is going to do a self-check. अपने गिरेबान में झांक के देखेंगे, why the purpose we are there. हम किस वजह से हैं. जब आपका पर्पस ही क्लियर नहीं होगा, तो आपकी अगर आपको आपकी अगर दिशा ही नहीं तैयार है, तो आपकी दशा कैसे सुधरेगी. Are you understanding this point? This is a very, very important point from an organization. इसीलिए मेजॉरिटी ऑफ द ऑर्गेनाइजेशंस फेल हो जाती हैं, क्योंकि उनको पता ही नहीं होता कि वो है किस लिए. उनका बेसिकली पर्पस, अगर सपोज आज गवर्नमेंट ने आईसीएमआर बनाया है, तो क्या मैं आईसीएमआर को दुनिया की बेस्ट ऑर्गेनाइजेशंस में गिन सकता हूं? अगर यस तो क्यों, अगर नो तो क्यों, है ना. बिकॉज द पर्पस वी आर. तो अब मैं जब अपने आप को वर्ल्ड, तो इसीलिए वर्ल्ड रैंकिंग्स निकाला जाता है. आज अगर लोग अगर बोल रहे हैं कि डेवलपमेंट इंडेक्स में ये डेमोक्रेसी इंडेक्स में इंडिया धीरे धीरे पिछड़ता जा रहा है, तो इसका खतरा सिर्फ आपके और मेरे लिए नहीं है, इसका हेल्थ पे भी इम्पैक्ट है, इसका हर चीज पे इम्पैक्ट है. क्योंकि फिर क्या होगा, जब तो धीरे धीरे करके ऑटोक्रेसी बढ़ जाएगी. ऑटोक्रेसी बढ़ जाएगी तो फिर जिसका जो मन चाहेगा वो करेगा. बजट जितना घटाना है, तो अल्टीमेटली द पीपल विल बी द सफरर. When the people will be suffering, so they will be suffering in every norms, whether in terms of health, economic, socially, politically, legally. Are you getting this point? So these things in public health, there is no, very strict border areas. So there is always an impact upon political, upon technological upon economical upon social upon political, and there's a vice versa. So it is not like there's not very tight compartments in which you can define. So that's why we say that public health is basically an interdisciplinary area. So when you talk about in public health, you have to look from different dimensions, and that's why the public health problems to solve are quite challenging. For example, if I take what is the impact of CAA NRC upon the health of the people of Assam. So this can be a good research project. That means you are talking about the most vulnerable population of the community. Because when you are saying human beings, then right to health is their fundamental right. So the question comes whether it's a need-based approach or a right-based approach. If suppose if it is a need-based approach कि भैया कोई गरीब है चलो उसको दे दिया, but the moment आप किसी को right बोलते हैं, तो since the person is born in that country, उसको पूरा अधिकार है कि गवर्नमेंट उसको वो सारी चीजें मुहैया करे. तो जब आप उसको vulnerable ग्रुप के अंदर देखने की कोशिश करेंगे, तो आपको ये पता चलेगा कि उसके सोशल इम्पैक्ट क्या है, लीगल इम्पैक्ट क्या है, पॉलिटिकल इम्पैक्ट क्या है, हेल्थ इम्पैक्ट क्या है, एंड a lot of other things. Is it clear? Is it clear
Yes,
to
sir.
everyone?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
So that's why it is written over here. See, strategy, develop a mission statement. So आपको बहुत सोचना पड़ता है. Why the purpose? तभी मैंने आपसे why, what is the purpose of doing public health over here? Why you are studying public health? आपने तो डेंटिस्ट्री किया है, आपने तो मेडिसिन किया है, तो भाई आपने अपने फील्ड में, बट पब्लिक हेल्थ ही क्यों? तो कुछ ने बोला भाई सर मेरे को तो डिग्री लेनी है, किसने बोला नहीं सर मुझे एक अच्छा रिसर्चर बनना है, सर मैं अपनी फील्ड को देखना चाहता हूँ मैं पब्लिक हेल्थ में कैसे इम्पैक्ट करता हूँ, सर मेरे को WHO में जाना है. सो सी everybody will have their own set of reasons for joining public health, but then does was this the reason to start MPH program? MPH program इसलिए नहीं, MPH program was basically started to create teachers as well as to good public health researchers, जिसके वजह से लोगों की population को आप improvise कर सको globally. Okay, it is a matter of fact you are now in India. Tomorrow you might to work with the people of some other country. So you cannot say I don't understand this, because overall the impact would be global. So the what is happening over here will also impact the people over there, maybe 20% plus minus, because of the other socio-economic reasons which might be impacting the health of the population. Is it clear to everyone? This point is clear to everyone?
Yes, sir. Yes, sir.
So
Yes, sir.
there are research partners could develop a mission statement. So then we have to basically work with the various stakeholders that identifies the desired outcomes and the general strategy of getting there. The mission need not describe details of the research or specific strategies, as these will be identified through participatory processes. See, जब आप बात करते हैं, जब आप चीजों को समझते हैं, उसका लॉग फ्रेम बनाते हैं, जब इसको बोलते हैं लॉग फ्रेम. This tool is being write in your notes. This is known as log frame. So log frame 4x4 का टेबल होता है. We make a table like this, like this. ये ऊपर एक लाइन खींचा ऐसे, एक नीचे लाइन खींचा ऐसे, और दोनों साइड से हमने इस तरीके. I will use my pen because my pen is not working. So I was to see. Otherwise I would have drawn. Just trying. तो इस तरीके से बेसिकली एक वो बनाते हैं, टेबल बनाते हैं, और उस टेबल के अंदर आपको लेफ्ट हैंड साइड में विजन, मिशन, आउटपुट, इनपुट, और राइट साइड में OVI, MOV एंड थ्रेड्स डाला जाता है. तो दिस इज नोन एज अ लॉग फ्रेम. तो लॉग फ्रेम आपको कोई भी पब्लिक हेल्थ प्रोजेक्ट बनाने के लिए आपको पहले लॉग फ्रेम बनाना पड़ता है. लॉग फ्रेम अगर आप बनाएंगे तो आपको बहुत क्लैरिटी होगा कि हम ये किस लिए कर रहे हैं, कौन हमारा टारगेट ऑडियंस है, वही हमारा टारगेट ऑडियंस क्यों है, उसको किस तरीके के इश्यूज है, और हम उसको. तो ये बेसिकली व्हेन यू डू अ पार्टिसिपेटरी, और कौन कौन से स्टेक होल्डर्स हैं इसमें. सो यू कैन सी ओवर हियर इट इज रिटन, द मिशन statement should describe the goals, the general strategy and the values of the research partners. Values से आपको समझ आएगा कि what is the purpose for which they are available over there. तो इन्फेंट मोर्टेलिटी रेट अगर आपको कम करना है तो वो ऐसे ही नहीं हो जाएगा. आपके उसके सारे सोशल डेमोग्राफिक फैक्टर्स आपको पता होने चाहिए. आंगनवाड़ी वर्कर क्या सोचता है, उस बच्ची का परिवार क्या सोचता है, लोग क्या सोचते हैं, वहां के NGO क्या सोचते हैं, गवर्नमेंट के लोग क्या सोचते हैं, और फिर आप अलग अलग एस्पेक्ट से देखेंगे. गवर्नमेंट कहते हैं हम तो करना चाहते हैं, भाई हमारे पास बजट ही नहीं है. आंगनवाड़ी वर्कर बोलेंगे भाई हम जाना चाहते हैं बट हमको उतने पैसे नहीं मिलते, हम तो फ्री में पिछले 6 महीने से काम कर रहे हैं क्योंकि हमारी तनख्वाहें नहीं आती. तो अगर तनख्वाहें नहीं आएगी तो मोटिवेशन कैसे बनेगा भाई? ये प्रैक्टिकल प्रॉब्लम है या नहीं है?
Yes,
आंगनवाड़ी
sir.
This
Practically.
is one of the major problems.
मेजर प्रॉब्लम. नाउ द थिंग इज आई एम द DM, मैं डिस्ट्रिक्ट मजिस्ट्रेट हूँ, मेरे अंडर पूरा वो शहर है. अब मैं वहां पे सुधार, तो अगर आप अगर मान लीजिए मैं आपको DM बना दूं, तो इस तरीके की प्रॉब्लम है, तो आप क्या करोगे फिर? मान लीजिए फाइनेंसिंग एक मेजर इशू है, अगर मान लीजिए फाइनेंसिंग एक मेजर इश्यू है तो मेरे को क्या करना चाहिए?
That's why when hello.
Yes, I'm listening.
That's why when I was the consultant of UNICEF at that time to support the, I mean the wages of because at that time 8 to 10 years back the wages of Anganwadi was very low. They were getting around 600 to 700 rupees.
Okay.
Later on, the government used to take help, financial help. UNICEF came forward. I mean, the government didn't ask for that, but UNICEF got the smell that to make the Anganwadi work in this situation, they need to be strengthened financially.
Very
So,
true.
so UNICEF going forward and at their own will. There was
And
no
at their
demand
own
from
will,
the
exactly.
At their own will, they supported the wages to some extent, and the government also they used to give something, and with the total money, because I would because I was preparing the budget and all that with the CMOH and all that. So in this way we.
Yes. I'm not getting your voice.
They should be economically happy. I mean, they should be satisfied that the wages which they are getting, it will not tax their. I mean, the
Very true.
Yeah.
So if I would have been, so maybe I will do a demographic profile of that area. For instance, suppose if I'm working in a Basti area, okay, in Madhya Pradesh, and if I happen to see it is more like a Christian dominated belt, suppose, where 90% of the population is from a Christian community, suppose. So maybe I will use my resources and I will try to go to some of the organizations like which like UNICEF, what you said, but maybe I'm getting some constraints, so I might go to certain other organizations in the US. Maybe I might go for some other organizations if there is. So one, you can make the profiling in terms of various different aspects, okay, without going into like, but at the same time you should not see, you should see like, there is no political implications of such a thing. That also has to be managed. For example, if suppose nowadays, if I try to take help from any of the Christian organization or any Muslim organization, tomorrow, some people might say, they are trying to influence the community in terms of, bringing, they are used to, they might be trying to use religion as an influence. Whereas I generally want to use that money for the general welfare of the people. Are you getting the point? So that might be one of the aspects. Similarly, like whether there are any funding organization, for example, there are so many multimillionaires in India, so maybe I go to Azim Premji Foundation or I want go to Tata Foundation, and I might ask them to get it as a CSR, as a part of the CSR. So what I mean to say is, when you have this type of a problem, if there's an issue of financing, so you always try to get some financer in lieu, if the government is not willing or if the government has a shortage of budget, so can you fund it and can you self-sustain it in the next 2 or 3 years or 5 years down the line? Okay, because see, unless and until in public health projects, one of the most important thing is when you start any project, and if you cannot self-sustain it after a few years, then there is no use. So it is very, very important, like the project what you are doing and the research that you are trying to accomplish, it should be able to meet this specific objective. It is like a parent who has to sustain their children, and if the children don't, become self-reliant over a period of time, they cannot, support them for throughout life. It is impossible. That's why majority, 90% of the public health projects fail, because in the inception stage itself, when you don't think about the sustainability of the project itself, you are laying down the ground for its failure right then and there.
Dr. Miraj, I just want
Yes,
to share only a few points. It
yes,
got stuck in my mind that
yes.
you already know that IMNCI program was launched in 2005 by UNICEF with
Ah,
cooperation from central government and state government.
ah,
Now, the thing was what happened that we could impart training
ah.
in many of the districts of West Bengal, like
Okay,
Malda, Birbhum, and
okay,
Murshidabad. But UNICEF said that we can have a training, or we can prepare or give a training, and one district will be a module for that.
okay,
And
okay,
government have to take the whole responsibility for training of remaining districts of West Bengal.
okay.
So things went fine, but I think Calcutta didn't had any training on INCI. And but one thing which was very important to me, that you have said the question of sustainability. Yes, that
Hmm.
is very, very important. What we have done and what we have shown, that should be carried out automatically, and the government should take the responsibility of further implementing the program. And that was not done.
This
Yes.
is one of the important bottlenecks in any of the programs. Secondly, I will share another example. In Jharkhand, we started with a telemedicine project. Okay, and because of the red tapeism and the bureaucracy, they said, like, if you want to implement a telemedicine, where we want implemented, like, we had a telemedicine software, and with that software we were giving telemedicine to the people who are living in the village areas, and we connected the PHCs with the your community hospitals, and community hospital with the district hospital, and district hospital to the main hospital, so that the people, for just even a small disease or for fever, they should not rush down to the, and the load or the burden can be basically reduced. Okay, now, and there was a system we introduced where we asked the people to just pay 10 rupees in case of any, and we tried to collaborate with the government doctors over there, and the project went very well for 3 years. But the most interesting part of the story is, this project was not implemented by Ministry of Health and Family Welfare. It was implemented by the Ministry of IT. Okay. So when we introduced this project, I understood from day one that maybe health ministry, because of the red tapeism, they might. So we looked for multiple stakeholders. And then this project was taken by the government. After this project was taken by the government, it was supported for 3 years, and then it was taken by another international organization. And then it basically sustained on its own by what the people used to give. So by that, there's something like the Delhi model. So till I was there, we implemented that project successfully, and then we went out, and then after some year, I came to know that this project is not running further. So what is very important in all the projects is
That's
the
quite correct.
participation of the various stakeholders. Stakeholders here, the most important stakeholders are the people. Can you make them self-reliant so that this project can be continued and the beneficiaries can get that benefit over a period of time without any bias? So that is very, very important in all these things. So any project what you do, or any research what you do, we need to first identify what the research is trying to accomplish, how it is going to benefit. For example, so what type of problems that the research is trying to solve, whether there are socio-economic, social, so all so you have to think very holistically. You have to think about the various stakeholders who are being affected. For example, if suppose if I have to implement certain health programs in a state, I would do an engendered log frame for the same. Now the question comes, what do you mean by engendered log frame? Just now I told you about a log frame. So I will write the vision, mission, output and input. So if I have to achieve a vision, I will divide it into mission, maybe in terms of month, January, February, March, April, May, June, or I will make it into various year, it means year by year. And then based on this year, I will make my output, what I am trying to achieve. And for that, what has to be my activities? The input has to be further classified into various activities. And on the top, I will write what are the means of verification and what are my threats and what are my indicators. OVI, that is mean objectively verifiable indicators. How would I know whether I am achieving my vision or not? How would I know whether I am achieving my mission or not? So same like you have a temperature, for measuring temperature you have a thermometer. In all the public health projects, you have got a time frame which is being indicated by your OVI, objectively verifiable indicator. But an important thing in all the public health in this scenario, suppose if I have to do a infant mortality rate project like this, I will further go a step beyond this and I will do an engendered log frame. Now the question comes, what do you mean by an engendered log frame? Log frame, just now I told you. What is an engendered log frame? Now an engendered log frame is basically when I do this vision, mission, output, input in terms of further division into the vulnerable groups. For example, women, because we know in an Indian society, the rights of a women and how women is being seen in this society is very different from the males. So there's a male perspective, there's a female perspective, and there's a child perspective to it. Now, for example, the female will say, who is the decision maker in the family? Suppose if I have to make whether the female is empowered enough to take a decision. If she is empowered, how does she, like, if she feels like the vision cannot be achieved because they feel that they don't have a bhagidari concept in the family, or she is being molested, or she is being, not heard properly. She enjoys a very low status in the society. So if the person or the main beneficiary, if she has to take care of her child, she is not the main decision maker, then how come you are going to improve the situation at the ground level? So here you are using a social impact. Here you are using a social tool in order to see the further. So you have to vision, you have to think of, you have to make a table, you have to write down the important components, and then you need to look from all the angles, from the top, from the bottom, from the sides, from the diagonally, and need whether your research is compactly integrated or not, whether all the ends are being met properly or not. That's why I'm saying that it has to be very focused one. It cannot be a very diversified, because the moment you make it more diversified, you will definitely lose from your focus. So you have to take broad objective, one objective, two objective, three objectives, and that's why it is like a research paper. When you write a research paper, it is very specific, just on one issue. So you are doing any study that you are trying to achieve three objectives. So each objective might be converted into a research paper. But it is only through how you have achieved it, how you approach this, what was your target audience, what was the inclusion criteria, what was the exclusion criteria, how did you define the problem, what did you do in order to define the problem, what were your tools, what was your methodology, and what are your interventions. And based on this, you prepare a general strategy. Is it clear to everyone? Are these points clear to everyone? Yes. Are you there with me or not?
Yeah, we are all
Okay.
there.
Okay.
Yes, sir.
So it will lead to, when you discuss all these things in details, it will lead to a general strategy. Like, what is the plan to attain the research goals? What are your long-term goals? So all the research goals has to be further divided into two groups, the long-term goals and the short-term goals. So suppose if you are attaining a vision, so vision has to be always long-term. Mission has to be short term. Like if you have to have a full 1 year from 56, if I want to make it to you, then you think of whether from 56 is it achievable to come down to 50. If 50, then 50 also you divide it into from 56 to 54, 54 to 52, 52 to 50. So if within the first 4 months you are able to achieve from 56 to 54, then you think from 54 to 52 it is the same or not. If everything goes on well, definitely you are going to, maybe you might achieve even 48. Yes or no? Okay, so strategy is very important. For strategy, again, strategy is a very big area. Strategy will comprise of your vision, mission. So there are three aspects over here: vision, mission, and accountability. So again, you will be very focused on what you are going to achieve. Your here the vision will be your full 1 year. Maybe you are trying to bring down to, and the mission would be from 54, from 56 coming down to 50. So 54, 52, and then 50. For this, what type of human resource you will be requiring, how many people you will be requiring, what is being expected out of them, what is the role of finance over here, who is going to fund it, how it is going to be, how you are going to get that funding, okay, how you are going to reach to the stakeholders, how your research will involve in organizing the meetings, workshop, interviews, data collection. Okay, so you have to break down these things into more defined objectives, which will be a part of your general strategy. What will be your methodology? Whether you are doing some intervention, or you are doing only a descriptive study, or it is just for the sake of academics. Okay, so this is it clear to everyone? Point number 2 is clear to everyone?
Yes, sir.
Then the point number 3, values of the research partner. This is a very, very important, because see why UNICEF is going to become a part of you, why any other organization is going to become a part of you, whether they are interested in philanthropy, or they have got other vested interest. Okay, what they are going to achieve out of it, why the people should listen to you, how you can make a behavioral change, what you will do to maintain the transparency and the accountability of the program. Maybe tomorrow the government machinery will ask you, like, you are involved in some sort of a back end transaction where you are trying to make money out of your project, and the government might seize your funds. Then what you are going to do? How will you do this thing in terms of organizing and capacity building and training? What will be the various roles of various stakeholders and how they will be all integrated together? So, the values of the various stakeholders who might be a part of your research project or maybe involved with you it has to be thought very deeply, and it has to be a win-win situation. Whenever any research project is win-win, then it will definitely become sustainability, or it will become sustainable on its own. Majority of the programs, why they lose or why they are failed, because they are not achieving the win-win situation. So win-win situation, I achieve, you achieve, together we both achieve more, then only any program could be sustainable. But if suppose the other person thinks you might be getting a more share and the other person might be getting a minuscule, then it cannot go on sustainable for a longer time. If suppose if I have to take some help from any local leader or politician, I might use this thing as a part of the PR building exercise. I might ask that politician, okay, if you do help me in terms of finance or in tomorrow, these people will recognize your good work and maybe a vote bank for you. Maybe if you do good work, that's why how the democracy also works. But if the person is not doing anything, he is not supporting, he is not providing the funds, and still the person wants, like, in order to continue in the seat, how is it possible? So there is no fixed rules. When you do a public health research, you have to really very pragmatic, you have to think out of the box, and you have to really address the situation in such a manner so that you can scale it up and you can see its effect at a mass level. Is it clear?
Actually, I just it is not becoming. I mean, what is the meaning actually of value of the research partners? What is the meaning of this?
Values of the research partners is, if you are involved, because public health researches are not done in a solitary way. There will be different stakeholders. For example, there might be people in the government who might be involved. Maybe you are taking somebody from Ministry of Health. At the same time, you are taking something from the IT ministry. There will be people, and there will be maybe an NGOs. Now, how what is the value of the research part? See, if you and me are doing some business, and you and me are doing the same thing, then what is the purpose that you or me both are there? Are you understanding? But if suppose if I'm good in bringing money and you are good in bringing technology,
That means you want to say that different research partners will have different role play.
they have got different. So this is what they bring value. So no business can continue in this world if two people are doing the same thing. Okay. So only there will be non-conflicting. There should be non-conflicting areas. So you have to think in details, like what is the value that they are bringing on the table for the sustainability of the research project, for the making of the research project.
Okay, understood. Yes. Thank you.
Okay. So whether they are involved in stakeholder involvement, or something is bringing about more transparency, or they are helping in organizing capacity building training, then you might have different partners, and then you are the one who is implementing it, but rest of the other people are maybe providing you the ingredients, or maybe they are being expertise of those areas. Okay. So in public, so that's why public health project is very different from any other project, because it is a very highly complex one. It will have multiple aspects and dimensions that you have to think of, and based on this, and you really need to have a grip of the situation. You need to understand the situation. What is the political scenario over there? What is their lineage? What is their liking? What is their disliking? What is their behavior? Okay, how would they react to a certain thing? Whether they are being open to new ideas or not? What are the various agencies which are playing around with them? What is their role? What is their depth? What is their strength? So when you talk in terms of a population level, you have to think, and that's why there's a saying, plan well before execution and execute the plan well. In India, we are in a habit of doing the things without having an appropriate planning. So if you don't have appropriate planning, automatically it will land up in bitter soup. Reason being, because you have not planned and you have not thought about all these things in advance. Had you have thought about it in advance, you have taken a lot of time in order to think, and then you execute it, then it will become much more easier in order to get the results. Okay, is it clear to everyone? And then
Yes,
once
sir.
you do it, then you will use various tools. So that the strategic planning tool, this is one. Log frame is a type of a strategic planning tool. So I will give you all the notes, means the study article for what is a log frame. Like you will do also in details when we'll discuss the various tools. So this is all we need to do in stage number 1. Is it clear? Okay. So in next class, we'll do the stage number 2. That is identifying and involving diverse stakeholders in the research. Okay. Yes.
Yes,
Any
sir.
question? Any questions? Any doubts? Anything which is not clear? Okay, and we will also kindly go through the research paper. It is a meta-analysis. So read about it, and who is going to present? So one of you should present that research paper. maybe in types of PowerPoint, maybe 10 PowerPoint, what is about it, what we understand from the research paper, what we learn out of it, key lessons for us to learn, and then we'll discuss about this research paper for half an hour, apart from the general class. Okay, Ujjwal, you will present.
Yes, sir.
You present that research paper, okay?
Okay, sir.
Make our PowerPoint for 10 slides and present it. Okay.
Sir, next week.
Huh?
Next class.
Next week. Yes.
Okay,
Sunday.
sir.
Sorry, on you present it on Sunday. Yes. Okay.
Okay, sir.
Okay. So that's all for today.
Okay.
So we'll meet next week. Okay. So kindly go through it, and then we'll discuss more in this.
Okay,
Thank you
sir.
so
Thank
much
you. Good night.
for having a very fruitful discussions we had today, and because the education is a matter of continuous learning. So it is we always be we are somewhere learning. We are in because neither education will fade or the knowledge will fade. It is always there.
Yeah,
But
it
we
is
have to
always
be
helpful, and
yes.
important thing is, see, when you actually do some project, so these tools are going to use,
Yeah.
you will be using it, you will be learning new tools. Okay, I will be sending you a lot of tools, and then because nowadays you can have various softwares for them, but in order to use those softwares, first you should have the theoretical foundation,
Yes.
right?
Definitely.
So nobody is going to, I'm very sure nobody is going to ask you what is a log frame in your exam. But
No, this
for a
will help us
practical,
in the future. It will help us.
yeah, but if you really want to do a good research public health project or a government project with any of the, so you should know what is a log frame, what is a PERT, okay, what is a
Yes.
CPM. So these are different tools, okay, that can be used and how they are used in various projects. So you will also learn these tools. Okay, take care, all of you. Good
Okay,
night.
thank you so much.
Okay.
Okay,
Thank you, sir. Good night.
okay, good night. Take care. Bye.